Hello, welcome to another time of health and wellness with Olajimoke. Today, I'll be talking about your heart and your health, and I'd like to start with the female population first. Do you know women are twice likely to have fatal heart attack compared to men? Why is this so? It is because women have some risk factors that puts them in this position. Things like pregnancy complication, premature infants, gestational hypertension, which simply means having elevated blood pressure after giving birth, which can continue for a very long time, and if not well taken care of, can result in more complication. And then premature menopause. Many women actually go through this immediately after menopause. They start experiencing some signs and symptoms of heart diseases. Also, things like stress, anxiety, depression put women at risk for heart diseases. It is also remarkable to note that women have smaller arteries than men, and when heart diseases develop in the smaller artery, it is difficult to identify, which may result in delay in treatment. When there is delay in treatment, it may result in more complication, and if not well taken care of, may result in death. So what should we be doing to protect our heart, not only as female population, even male population inclusive? First thing I would advise today is to monitor your blood pressure. Recommendation is to have the systolic blood pressure, which is the top number, to be between 90 and 120 millimeter mercury, while the diastolic blood pressure should be between 60 and 80 millimeter mercury. So that means we are looking at something like 90 over 60 to maximum of 120 over 80 millimeter mercury. If your values fall outside this, you need to start talking to your healthcare provider. So I would advise you get a sphygmomanometer, which is simply a blood pressure measuring instrument. Anybody can purchase this in anywhere on any store. You can even get it online. You don't have to be a healthcare provider to be able to use these instruments. They are wrist type, which is easy to use. Just follow the instruction on the manual, and then you know your blood pressure. So I want to encourage you, start monitoring your blood pressure daily. Have a particular time in the day you do it, just to keep track of your blood pressure. Second recommendation is to maintain ideal body weight. So the body mass index recommended is between 18.5 and 24.99. Body mass index, also known as BMI, is the way to track how ideal your weight is. You can easily calculate this by putting in your height in meter square and your weight in kilograms. If you put these two values even just on Google will calculate your BMI for you. So if your value fall outside this norm of 18.5 to 24.9, you should start talking to your provider, and better still, start working on your weight. If your weight is on the lower level, you should start eating healthy food. If your weight is on the higher level, if you're above 24.99, you should start working on your diet. Diet is a big factor that promotes obesity and overweight. So you need to start working on your diet. And in line with what we are talking about today, I would advise eat healthy diet, heart-friendly diet. This includes your fruits, vegetables, all grains, legumes, and nuts. Make sure you are including all these classes of food in what you eat daily, and avoid overeating. All of those big bowls of food don't do us any good. So eat in bits. Don't eat too much to improve your heart and your health. In line with either weight control or even these heart conditions we're talking about is exercise. Exercise is very important. The World Health Organization recommended at least 2.5 hours of exercise per week. You can have a 30-day routine a day and continue down the week, or you can do much as you can, part-time, per season. And I also like to chip in that those house chores you do, those cleaning, those sweeping, they also exercise your body. So do what you can, and if you think you're not doing enough per day, put in at least 30 minutes of exercise to improve your health. One other recommendation I like to put out today is reducing stress. Reducing stress. Stress is a risk factor for heart diseases. So make sure you have your mind free of anything that can put you in stress. If you feel like you're getting too much stress at work, work on it. Talk to someone who can help you to improve your health. And lastly, I also like to put in terms of exercise, you can take a walk. Take a walk to the grocery store. Take a walk rather than drive if it is not a long distance, of course. And also, rather than use the elevator, use the stairs. These little things help improve your health. And I hope you're not. If you are, go ahead and start working. If you're smoking, you should start working on how to quit, because smoking puts you at risk for heart diseases. I hope these little things are easy to do for you in order to improve your health. Till we'll meet again on Health and Wellness with Olajumoke, I want to encourage you to stay healthy and stay positive. Bye for now.